There's been a lot of buzz around John Cena's hair. How has his hair changed? Has he had a hair transplant? Let's take a closer look throughout the years. And if you haven't already, please subscribe to my channel. In 2005, at the age of 28, we can see here that John's upper and lower horizontal thirds of the face look proportional. The middle third is his shortest segment. John has a strong brow ridge, which is one of the characteristic features of his face. When we look at his hairline, we can see that there's a central part. And while central parts are fairly rare in men, they of course do occur. The more common directionality of men's hairlines is a fanning type of directional flow. But for many men, it's not a standard fanning type of pattern. You might have one side of your hairline that has a more, let's say, anterior direction, and then another part of the hairline might be moving more towards one side. It's important to observe that natural directionality, especially when we're doing hair transplant surgery, because if you don't mimic the natural flow of one's hair, it won't look like a natural result. And that's one of those elements that makes a high-quality hair transplant stand out from the rest. In 2006, at the age of 29, what we see here is that John has strong anterior temporal points, and that helps frame his face. The anterior peak of the temple should not be any more medial than the tail of the eyebrow. That is a great reference point when I'm designing temples for patients. And John's natural hairline is quite straight. In 2007, at the age of 30, what we see here is that the directional split that I was talking about previously at the central hairline occurs only for the first 1 to 2 inches of the hairline. Then further back, it changes to a more anterior facing type of directionality. It is these nuanced features that makes hair transplant surgery both challenging but also exciting to perform. And in 2008, at the age of 31, I want to point out here that his crown hair looks quite strong. Usually when people think of crown thinning, they're most concerned about how that will look from the back of their head. But when you look at the profile of someone's head, that is sometimes the best way to observe the fullness or sometimes lack of hair in the crown area. What you'll see in someone who has a thinner crown is that when you observe the contour of their head essentially from the front to the back, there will be a drop off of density, and that's pretty clearly seen on profile view. When that crown density is boosted, you'll start to notice a more even contour that then develops. And here are a few of my own patients where you can see that taking place. After the crown hair grows in from the transplant, that nice even contour is reestablished. And that's very clearly seen from the profile view. But in John's case here at the age of 31, I don't see any obvious drop off in his crown area. And in 2009, at the age of 32, I see no further changes, and that's the same through 2014. In 2015, at the age of 38, when we compare back to John at the age of 28, so 10 years prior, we can see some very slight frontotemporal thinning. His hairline is now slightly less straight, and that's why when we design hairlines for patients, especially in their 20s, they're sometimes asking for these very straight hairlines, but we know that that will change with time, and they're going to have at least a minimal degree of recession develop. So we try to mimic that when designing hairlines for patients in their younger years. Sometimes it's not just about giving patients what they ask for, but really looking out for them as far as how they will mature and age with time and making sure they look natural, not just in the moment, but also in the future. And it's interesting to point out that when you look at John Cena's crown in 2015, you can already see some thinning hair. And that's especially obvious when his hair is longer. So even though there's been this recent chatter about his crown hair loss in recent years, when we look back over 10 years ago, we also see this type of crown thinning. Some people only experience crown loss with their hair loss pattern, and sometimes the hairline looks preserved. So that's one of the reasons why I'm not a huge fan of the Norwood-Hamilton scale for especially clinical use. There are many more patterns than just the 7 that are represented in the Norwood scale. In my clinical practice, I see hundreds, if not thousands, of slightly different hair loss patterns. And it's important to point out here here that for most men, it's usually in that decade from age 25 to 35 when guys will experience the most aggressive hair loss that they will at any other time in their life. Now, that's not the case for everyone, but that is where most people experience the majority of their hair loss. So for people who care about their hair, that's especially the decade when you want to try your best to prevent further hair loss. And as we've talked about on the channel over the course of many videos over many years, finasteride is going to be your best friend in helping to prevent further hair loss. It of course has some potential for side effects, and we have a video dedicated to just that, but the majority of patients do very well on standard dose finasteride. And when they need to, they can drop down to a lower dose of finasteride and tolerate it extremely well, where they're getting the protection for their hair, but with little to no effect on the rest of their body. And many people these days are finding it very easy to go to feelconfident.com, fill out a questionnaire, and obtain finasteride safely. And I wanted to make sure here that you all know about our newsletter. We send out a newsletter every few weeks that has the latest information on facial plastic surgery and hair restoration. So if you haven't subscribed to the newsletter already, make sure to head to feelconfident.com and do just that so you stay up on the latest information related to these topics. In 2016, at the age of 39, I see no change. And in 2017, at the age of 40, in my opinion, John's crown loss appears stable. The base density here is at about 15 to 40%, depending which part of the crown we're referring to. And remember that we usually start to see some degree of hair loss when at least 50% of the original density has been depleted. And by that point, it becomes very difficult to take the hair from, say, 50% and boost it all the way up to its original density. So it's important to identify hair loss early so you can give yourself the best chance at protecting what you have left. In 2018, at the age of 41, we now see that John Cena is wearing his hair longer. And where he has that central part that we talked about, you can see that there is this illusion of thinner hair in that area. And that's always the case. Anytime you have a part line, it's always going to look like that portion is the thinnest portion because that's where the direction of the hair is changing. And even when we do a hair transplant and we go into that area with more grafts, if we do it naturally and we follow the natural directionality, you still will see a thinner area where the part line is. And that is something that I stress ad nauseum to all of my patients so that they understand that it's not that we didn't put enough hair there in that part line, but rather that that is a natural appearance to anyone's hairline part. And if instead you try to change the natural directionality and place hair in a different way that it is in the vicinity, it will look a lot less natural and it will just look strange. And the naked eye will perceive that something looks off and maybe even fake. In 2019, at the age of 42, I see no change, and that's the same through 2022. In 2023, at the age of 46, this is around the time that a lot of people started to talk about John Cena's hair, and they were concerned about his crown loss, and they were wondering, why he hasn't had it fixed, right? So that was a lot of what was being said online at that time. But to my eye, when we look back at photos of John from, say, 2015, the hair loss looked very similar. It's just that I think with his shorter hairstyles, people didn't exactly pick up on it. And for movies, I think he was combing his hair mostly back and maybe even using some concealer to cover up that crown loss. But then in 2024, at the age of 47, there were two specific times when people really saw John's crown and they started to get, I guess, somewhat concerned, or they really just started to, talk about it more. The first was in WrestleMania 40 in April of 2024. And the second incident was on the Kai Cenat live stream in October of 2024. And with this increased attention on his crown thinning, John Cena had the following to say: "Man, I know I got a bald spot on the back of my head. I flossed it at WrestleMania. Me, you, and like 7 out of 10 dudes have them. So I don't care. I'm not perfect. That's not me." So my reaction to that is that embracing our imperfections is a beautiful thing. Look at me. me. I'm bald and a hair expert at the same time. Life is full of paradoxes and inconsistencies, and that's fine. I was totally cool with John Cena embracing his natural appearance. But then 2025 hit. Maybe John does care about his bald spot after all, but I do think that it's unlikely that he had a hair transplant. Just the timing of it all and the lack of scarring that I'm seeing just makes me feel that it's most likely not a hair transplant. But remember that there are many ways to conceal thinning hair. Some people wear wigs on their head. Sometimes they're called hair pieces. Others use fibers, which is probably the most common way to cover up some areas of thinning. Yet other people get less invasive procedures like scalp micropigmentation. And then of course there are people who just get very creative with their hairstyles and they're able to cover up some of those areas that have thinned. So maybe all the talk about his hair did finally get to John, where he was like, hey, maybe I should do something to cover up the area so people can focus more on my actual movies and on my wrestling and not so much on the thinning of my hair. Celebrities are human beings and they're not immune to public ridicule. And when it's not just a few people writing it in comments, but millions and millions of people saying that, hey, maybe you should address something, or, some popular talk show bringing it up, it gets people thinking that, maybe they should actually address it. But I think it would have been cool if he did nothing. But clearly he wanted to do something about it so that probably fewer people would talk about it. John had the following to say in an interview on March 31st, 2025. I'm one of those folks in the 7 out of 10 men with thinning hair. I've learned that, hey, you're not at the mercy of the court. You need to keep the hair you have healthy. So now I take care of the follicles I have on my hair because I want them to last as long as they can. I do minoxidil at night. I do red light therapy. I take vitamins. I make sure I'm washing and conditioning with products that strengthen my hair. So now it looks like John is purposefully trying to preserve and strengthen his hair. But as I said earlier, and as I talk about in many of my videos, the only way for men to protect their hair and to keep it from falling out at a high fidelity is with the use of finasteride or dutasteride. There is no equal substitute. Not with minoxidil, not with laser light, not with vitamins, or with any other product. These other options can help thicken your hair, but it will be a losing battle over time because they're not getting at the root mechanism of why the hair is falling out in the first place, which is androgenetic alopecia. That is a hormonal process where you have testosterone being converted to a stronger form of it called dihydrotestosterone. And as that happens, you get the attachment of the DHT, the dihydrotestosterone, to sensitive receptors on the hair follicles themselves. And when that process occurs, you start to get a miniaturization of the existing hair follicles, especially in areas where the follicles are DHT sensitive, which is primarily this central corridor. So the finasteride and the dutasteride are blocking that hormonal process from occurring by reducing the conversion of the testosterone to its stronger, more potent dihydrotestosterone. And when it comes to thickening one's hair, John definitely brought up a few great options, but of course the shampoo and the conditioner that we use is also very important. And maybe we should send John some of our GQ award-winning shampoo and conditioner. These have the key ingredients that it takes to help maintain your hair. But again, the shampoo and conditioner are not a replacement for finasteride. They're simply an adjunct. Do you think more celebrities should avoid plastic surgery? Or do you think instead that they should opt in if they have the resources? Let me know your thoughts in the comments below.